Being able to de-bias ourselves is an important aspect of clinical reasoning, and the first step, as you've seen above, is actually being able to recognise that we have that bias and be able to take proactive steps against that. In this section, we're going to look at how we can potentially de-bias ourselves to make a more balanced clinical reasoning decision. So far, we've learned that System 1 is generally the culprit for cognitive biases, and we've also learned that System 2 can be used to actually try to de-bias ourselves. In this section, we're going to look at some tactics that are explored within the literature to help us try and de-bias ourselves by using System 2. So how can we start to de-bias ourselves? And the take-home point from this is that we're actively trying in our mind to move away from making intuitive decisions to making a more analytical decision, in the hope that doing that, we'll be able to identify any biases and counteract them. And one thing that the literature says that we can do is slow down in our decision making. As we've learned, System 1 is associated with fast decision making. By slowing down, we're actually forcing ourselves into a System 2 mode of thinking, and we're able then to make more analytical decisions. So try and slow down and think about your decision. A way that we can do this is to simply ask ourselves the question, am I doing this correctly? Or am I doing this right? Have I missed anything? And this can help you move from System 1 to System 2. The next thing we can do is to apply metacognition. Metacognition is thinking about thinking and being aware of our own thought processes. Some things that we do are inherently associated with increasing metacognition. History and physical examination, for example. The purpose behind this is to gather systematic information. We also do things like creating a differential diagnosis list. And what this does is force us to consider other possibilities that the disease process could be. We also have things like mnemonics as well. And these are a great way to prevent memory failure, and that we can remember things quite easily, such as Vindicator, for trying to come up with a differential diagnosis list. And there's many others out there as well. Another way to promote metacognition is to think about red flags and systematic inquiry at the end of your history-taking session. And this can help you avoid any missing conditions or serious things that need consideration. The next thing we can use are checklists, and arguably sometimes checklists can become a tick box exercise. However, what checklists do really well are to actually alert us to if we've missed anything, and if used correctly, can actually be a really good tool. This is why we complete them before surgery. This is why we complete them as well when we're admitting patients generally. And they're a good reminder of things to do or things that could potentially miss. Another obvious one is to actually understand statistical principles, and we've gone through those. And within the literature, this is actually a really good way to move from System 1 to System 2. We can't intuitively think about probabilities. We have to do that systematically and analytically. And the only way to do that is actually move into System 2 to think about that. And the final one is something that sounds quite complex, but actually is very simple. This is called dialectical bootstrapping. And this is actually forcing yourself to assume that your first answer is incorrect and re-look at the problem. And this has been shown to actually move you from System 1 to System 2 by actually second-checking yourself. Moving from making intuitive decisions that are based in System 1 to more analytical, which are based in System 2, is quite challenging and sounds quite theoretical. There's some key take-home points from below, from Klein in 2005. Although seminal work, some of these techniques have been shown to actually be beneficial in reducing error. I think the key take-home message here really is to slow down and think about what you're doing. And by doing that, you actually force yourself away from intuition, more into a second-checking analytical System 2 mode.